Welcome, Erin. Thank you so much for joining us and for sharing all this information with us. To start this conversation off, I would like to ask you, besides being a bedside clinician, what is your role title position?
Yes, I'm very excited actually to be coming on to Duke here with two different roles that I'll be playing. First, I am going to be the medical director for Duke Life Flight's event medicine program. So I'll be able to work with the stellar nurses and paramedics that are part of the Duke Life Flight event medicine and help cover the many, many different events, both sporting and non-sporting events throughout the school year as their medical director. And the other role that I'm going to be playing is the medical director for our ED emergency department based paramedic program, which is a new program that started about 8 months ago. And they're passing the baton on to me now to take the fledgling program and run with it and expand the roles of the paramedics in the emergency department. So I'll be playing both of those roles as well as being a bedside emergency medicine physician.
Wow, that's really amazing. So what is next for you in these multiple roles that you're playing?
Yes, so obviously I'll start with the paramedics, with the increased numbers of patients we're seeing in the emergency department and with just some, outside difficulties with staffing and everything, I think the paramedics have an incredible niche that they can play and fill in some of these areas of need. So I'm very excited to be able to be a part of this program now as we're growing the roles and responsibilities of the paramedics in the emergency department. And although there are ED-based paramedic programs throughout the country, I think that this is still a relatively new concept. And so I think it's a really exciting time to be a cutting edge leader in this area and show what paramedics can do at the emergency department level. And in terms of the event medicine, this will be an interesting year, of course, because we're expecting the events to go back to semi-normal, but with COVID the way it is now, we'll see what happens with our events in terms of people being able to attend and everything. So this first year as an event medicine director will probably be marked with flexibility, and we'll have to see what our program has to do in order to be able to safely provide medical care at these events during the continuation of the pandemic. So it'll be a challenging year as a medical director in event medicine, but we're excited and the team is fantastic, and I'm excited to be able to be a part of it. So.
That's great. So before we end, a more personal question. Would you like to share anything personal in your life that has happened since your residency, since joining, that has influenced any of the things that you've mentioned above?
Yes. So I am coming from Texas, actually. I did my residency in the military and I served in the United States Air Force for 7 years and just finished my military service last year in 2020 and have just been out in the civilian world for about a year. I did my fellowship in emergency medical services in Houston last year after finishing up the military. So certainly my military experience has definitely impacted my interest in EMS, which is what brought me here to Duke, and my interest in event and paramedic medicine. So my various experiences in the military certainly have influenced that. And then from a personal side, we're expecting our first baby in the next couple of months. So that will be a big milestone for us. And so we're just on the countdown of the last, 7 weeks or so before baby is due. So we're very excited about that too.
That's amazing. Congratulations.
Thank you.
Well, thank you so much for taking the time to talk with us and share everything with us. And good luck with all of this.
Thank you so much, Erin. I appreciate it.